Good evening. Welcome to ONV, a healthy conversation. I'm Nurse Pat, and tonight my guest is Alice Jordan. September is Suicide Prevention Month, and that's what our discussion will be about. But I have a scripture that I think is fitting for this occasion. Psalms 55:22. Cast your cares on the Lord, and he will sustain you. He will never let the righteous be shaken. And I'm going to turn to Alice and let her introduce herself, and we will go from there.
Thank you, Pat. Thank you very much for the invitation, and I'm honored to be here. My name is Alice Jordan. I am the director of the Behavioral Health and Family Studies Institute at Purdue University, Fort Wayne, but I'm a very proud IU alum. I am also the director of the Indiana Suicide Prevention Coalition. I am a master trainer for the QPR Institute. It is the leading suicide prevention training program, evidence-based program that our country has available to them. But more importantly, I'm a proud mother of three, proud grandmother of five, and Southsider, Elmhurst grad, and I'm a hometown girl.
Now, Alice, you and I have known each other for quite some time now. We've worked together, but it says Suicide Prevention Month.
Mm-hmm.
Can suicide actually be prevented?
It can't, well, let's just say it a couple ways. It can't be predicted, but it can be prevented. And as a statewide suicide prevention specialist, Pat, I'm supposed to sit here and say that all suicides are preventable. But unfortunately, unless you're with somebody 365 days a year, 24 hours a day, you can't really assure someone that won't take their life. However, what makes it more preventable than anything else is the power of connection.
Okay.
Connection is what saves lives because, Pat, don't we all want to be seen? Don't we all want to be heard? And frankly, don't we want people to see our pain sometimes? So the power of connection is so valuable in life-saving measures. And it's important that we understand the struggle because I don't know what's going on in your world, Nurse Pat, but I can tell you what's going on in my world. And I can tell you what's going on in the life of many people. It's a struggle. And it's more so now, more than ever, with the political climate, with racism, oppression, people struggling day by day, paycheck to paycheck. I mean, I realize that's a cliche that many people say, but the struggle is really real. And I'll have to tell you that this month has been a very heavy month. This is about my 20th year in this field.
Okay.
And it is, I would have to say that this month I have been contacted numerous times, not just people wanting a training or a presentation, but just being heard.
Okay.
Because don't we all want to be heard too?
That is true.
And no matter what walk of life you come from, and I can't say it enough, we all want to be seen, especially during a time when so many people feel unseen, unheard, and it has a rippling effect to other areas of one's life. And it leads to depression. It leads to anxiety, and I get up every morning, Pat, and ask the dear Lord to give me the confidence, the energy, the momentum to make mental illness just like any other socially accepted illness. And I'll tell you why. Because First and foremost, I am championing you like I always do. I mean, I'm challenging you as I always do, your listeners, your viewers, to be the voice of change. Because unless we who have interests in mental health or have compassion about other people, we have to acknowledge and realize that mental illness is just like any other illness. Because when you think about it, Pat, 30 years ago it was cancer. As a matter of fact, I remember every Tuesday my grandmother, I'm Latina, and my grandmother would have the ladies, the viejitas, the older ladies in the neighborhood come over for café y galletas, coffee and cookies. And I remember my grandmother speaking to me in my ear in Spanish, leaning over to me, and she says, "Don't sit next to her because you're going to get cancer." And the
Wow.
reason why back then, 30 years ago, because of lack of education and lack of awareness, thank God for Betty Ford that put cancer on the
Right.
map,
Right.
And then think about Ryan White, the young man who got AIDS through a blood transfusion. You know, he's from our beloved state in Kokomo, Indiana. When he went to school, there was a 65% absent rate, not only in the school building that he attended, but the entire school system, because parents were afraid that if Ryan White came home, Ryan's white book bag or wheelchair touched their child, they were going to come home and infect the entire family. But what are we doing today, Pat? We're wearing red ribbons. We're wearing pink ribbons. People with AIDS and cancer are living healthy lives. They're contributing members of society. And that is why. Why? Because people such as Ryan White and Betty Ford championed to make cancer and AIDS just like any other socially accepted illness.
Correct.
So we must. The struggle is real. And the thing is, until we start identifying and understanding that mental illness is an illness, it's a disease, we are going to continue to have people who are going to have suicides, homicide by cop, killing themselves. And unfortunately, even in our own community, we've had an abundance of suicides.
That is true.
And we, and look at our jails. If you look at talk to our sheriff, talk to our county councilman, talk to our mayor. Our jails are filled with people who should not be there. Since when do we incarcerate people when a body organ is broken? And that's what it is. I mean, if you want to talk legits, if you want to talk, a spade, let's talk the facts. And we need to. And I say this not only because of my experience, but I also have lived experience.
Okay.
I am a suicide attempt survivor.
Okay.
Not because I wanted to die, but because I wanted my pain to end.
Okay.
And many people don't see suicide attempt. Many people say that you're being selfish, or that was so bad of you. When someone, sprains an ankle, breaks their leg, they walk with a limp, and nobody makes fun of them. But when the brain is broken or bruised, we expect them to think in its totality, to think clearly. They're very, as my mom would say, the thought is very foggy. And we need to stop condemning people for one of the body organs breaking down, whether they're broken, bruised, or just out of function.
Okay.
And we got to start doing that, because otherwise our suicide numbers will continue to increase. People will continue to suffer in silence, and we will have a mental health condition that this country is not going to be able to handle.
Now, I had a question here, something you said there. What would you say to a parent? Because a lot of times when a child, especially a teenager, cry out, I had dealt with that recently. The parent said, oh, they're just seeking attention.
Lord, don't tell me that. I know, I hear it all the time. As a matter of fact, I was doing a training yesterday in Kansas, and one of the teachers said that to me. And I said, and you have to say this respectfully, not condescending, but you need to tell the parent, so what? So what if they want attention? Because what you want to do, you want to empower the parents. Would you rather give them the attention now, or would you rather give the attention of a gravesite for the rest of your life? I mean, I don't mean to be condescending. I don't mean to be disrespectful. But that young child, and even adults for that matter, are seeking attention. Why? Why? But why? Because of the lack of connection.
And that's and it is. I said, well, have you tried to figure out why they're seeking your attention? And this particular parent had a list of reasons. Well, I took their electronics away. I
But also
punished them. So this is their way of
sure
of acting.
Right.
More or less, it was an acting out.
Well, I'll tell you, it has been my experience that the older the parent is, the less understanding. And I say that respectfully as well. Because, back then, first of all, mental health, you were considered cray-cray, schizo, or loco
Yes.
or loca. Or you were the Uncle Pete at the family reunion, chain smoking, We, as parents, we bring these these bodies into the world, and we have this pride and this knowledge that we're supposed to raise our kids to the best of our ability. I know as a parent too, when you can't fix your kid, you think there's something wrong with you. So it's another ripple effect that, the older the generation, the less understanding. And it's especially applicable when it comes to men, or, that, they're weak, and excuse me, they'll call them names like, I won't say on your right here, but some names that are very inappropriate. But I must tell you, for your listeners and your viewers, the best website for men is mantherapy.org.
Okay.
Mantherapy.org. And I have a poster in my office that gets quadruple looks. And it says, men need to pay attention to their mental health as they do their penis. And it's true.
Okay.
It's true. It's true, because men die more by suicide. Women attempt more.
Okay.
And the reason why, number one, is because they've been discouraged to ask for help because it reflects a sign of weakness on their part. And also the mere fact that, they're supposed to be machismo. They're supposed to be the man of the house. And they're supposed to set the standard, and nothing, sways them one way or another. We need to do a better job in raising our young men to understand their feelings and process their feelings. This month I've been very intentional and staying into my own truth, being very transparent, because I never know who's listening.
Okay.
People need to stand in their truth. If they have their own struggles, don't hide behind that. It is who you are. And you never know, your frankness, your truthfulness may save someone else's life. And I don't know about you, but I never take that for granted.
Okay. Now, I've often heard you say, because like I said, we've been around for a lot, the term committed suicide.
Yes.
And I've heard you say, well, if someone dies from cancer, we don't say they committed cancer.
Right.
Or they committed
diabetes,
heart attack.
Or heart attack, yes.
So what would be the proper term?
Well, first of all, the
if
reason
they
why
died by suicide.
This is an example of tomatoes.
Okay.
Language in the mental health field matter. It is profound. It holds a lot of weight. The word commit in some languages, in some cultures, connotes a sin or a crime. Someone commits rape. Someone commits murder. 99.99% of the people who die by suicide didn't want to die because they wanted their pain to end. And that's very relevant when we have a headache. What's the first thing we do? You have aspirin, you have ibuprofen, you have Advil, you have Tylenol, because we want that pain to end. When the brain is broken and bruised, it can't think in its totality. It can't think rationally. So the first thing they want to do is end the pain. And because they don't have those protective factors, and what I mean protective factors, meaning characteristics that make it more unlikely that someone would take their life, things that they value, hold in high regard, like my faith, my family, my dog, my occupation, my work family, my faith family. But also you have risk factors. Risk factors are characteristics that make it more likely that someone would take their life. Losing a job, losing a mate, foreclosure, not making the homecoming court.
Okay.
It could be a plethora of things. But language matters in our field. And we need to extract that word that brings shame on the individual because they didn't want to die. I could tell you with great confidence, and even Kevin Hines, who came to our mental health summit, he stated the millisecond he let go of that railing, he knew he did not want to die. But there was no going back. The same thing with my case. I didn't, I was young, I was 16. I was in a Latino family. I come from a family of 14 children, 2 girls, 12 boys. My purpose and my culture was to help my mother, help my father after 301, after I left for school, was to go home and be that server of, meeting the needs of my family. But, I wanted to have an American boyfriend. I wanted to play the American sports. I wanted to have an American social life. But that was, that wasn't allowed back then. But nevertheless, I wanted my pain to end. And at that time, that's the only way I knew how.
Now, how would we address me if my child or my grandchild came to me and said, I think that I want to end my life? How would I address them? Where would I turn to? Because I don't know where to turn. Where would I turn to get help?
Well, first and foremost, you got to remain very calm. You can't, you can't overreact, because your reaction will dictate what they're going to say to you. That's a scary thing to hear. First and foremost, you need to commend your child for saying something that society, maybe the family, the culture has told them never to talk about. I don't know if you've ever been depressed, Pat, but being depressed is a very dark and lonely place to be.
It is.
And to have someone call you brave and courageous, that kind of preps them up a little. You're looking at me as being brave and courageous? Well, that's the first thing as a parent. And the thing is, when your child says something like that, there is no magical word to say. But you do say this, whew, I don't know what to say, but I'm so glad you told me.
Now, where would I turn to get help?
Well, here in Fort Wayne, we're very fortunate. Of course, we have Park Center. It is on a fee basis, meaning, according to your income. We do have Parkview Behavioral Health if it's an inpatient that is required, if it's required. Also, Maple Heights is also an inpatient treatment center. But more importantly is getting your young person involved in various support groups. Also, if you feel that your young person is, having an episode or is having a mental health crisis, and you don't necessarily want to take them to the emergency room, because that in itself is trauma.
Okay.
We're very fortunate. We have an SOS mobile team unit through Parkview. Did you know that?
No, I did not.
So, for example, there's a number, and I'll provide you with all this information to let your viewers and listeners know. But you call this number, and Deb Henry from from Parkview Hospital, she has a team who have lived experience as well, who has been on the mental health journey, and they come and assess the individual in the environment that they're in.
Okay.
Because many times, again, Pat, a lot of times that team makes that individual be seen and heard.
Okay.
And that doesn't require an emergency admission. That doesn't require being admitted into a behavioral health unit. Maybe it's learning some coping skills, some resiliency skills. That team is so valuable to our community, and it's one of the biggest secrets.
Yeah, because I've never heard of it before.
There's no fee associated with it.
Okay.
And it's a mobile unit. They come and to your home and assess you there. But if you do need treatment, don't be ashamed of it. You wouldn't be ashamed if your leg was broken.
That's
true. You wouldn't be afraid if your arm was broken. We need to start understanding and acknowledging and embracing mental health. Because otherwise, since we started, Pat, in America, 4 people have already died by suicide. On an average, 130 people die by suicide in the United States of America. I know if a plane crashed every day and 131 people died, we would not be flying in America till we got to the root of the problem. Why are we not getting to the root of this problem? And so much money has been taken away from the mental health field because of the new administration. And this show is not about politics, but it's facts. We've made a lot of inroads, not only in Indiana, but also the United States. And we have regressed in the last 6 months of funding that has been withheld on specific initiatives. Like I was involved with an enormous African-American suicide prevention initiative to discuss how youth violence and mental health associate with each other, and that was yanked.
Well, Black people don't die by suicide.
Well,
we don't do that.
Yes, I'll tell you. Well, they do. And unfortunately, Pat, I'm here to tell you that here in this community, I also am part of a LOSS team, which stands for Local Outreach to Suicide Survivors. We provide services to families who've been touched by suicide, meaning they've lost a loved one, because suicide grief is like no other grief. And the main goal of a LOSS team is instilling that seed of hope for that family, because it's a very isolating type of grief. But going back to what we were talking about is that I forgot my point. What was it again? I'm sorry.
We were talking about Black people.
Oh,
don't
yes.
do
So
it.
I would rarely go to homes of African Americans or Latinos. Here in this community, we've had more Black suicides and Latino suicides than I've ever been in my career in mental health.
Now, it's 30-minute talk, and they're going to be counting us down here. But some of those numbers you were talking about, I need help, and I need it now. What number would I dial?
Well, first and foremost is 988. 988
Okay.
has replaced the National Suicide Prevention Hotline. And the thing is, it's not just for people who are suicidal. It's anybody who just wants to talk to someone.
Oh,
Or
so it's a live person?
yes, it's a live person. And it's not somebody who, works at a fast food restaurant. And I say that respectfully. During the day, these are licensed, these are trained individuals who are answering these calls. We also have a national text line, 741-741. And then we also, you can also text through 988 as well.
Okay.
And so thankfully, those programs are still available. I do know, however, that organizations such as the Trevor Project, which is the leading organization for the LGBTQ plus population, that had their own crisis line, own text line, that they lost pretty much 90% of their funding.
Okay.
And so I don't know about those particular organizations, but here in Fort Wayne, we have a good group of people that are spearheading, such as Stop Suicide of Northeast Indiana, being led by Colleen Carpenter, one of the coalitions under the umbrella of the Indiana Suicide Prevention Coalition. And also, I truly welcome and encourage all your listeners and viewers to come to the Out of Darkness Walk at Headwaters Park this Sunday. You will be amazed by how many people are touched by suicide. Because, we don't talk about, I lost my son to suicide around the water cooler.
Right.
Many people tell me that when they go to this walk, I've worked with this woman for 15 years and I never knew she lost her son to suicide. And the reason why she knew it is because she saw her at this walk and she said that she was walking in memory of her son.
Okay.
So again, we've all been touched by suicide, whether we wanted to admit it or not. We've all been touched by mental health as well. So we need to come into community to be unified, support each other, but never underestimate the power of connection. Never underestimate it. I usually wear a pin that says "Be kind." I teach at PFW, and I always tell my students, remember to be kind to others, but remember to be kind to yourself. We got to be kind to each other. I mean, especially during this time. And we never know the journey somebody's walked when you see them face to face.
That is so true. And before we do close, one thing that you touched on was faith. I have heard, I cannot say that I know this to be true, that some religions teaches that if you do die by suicide, you can't get into heaven. So how do we explain to the family of the suicide person that their
The heavenly gates are
purse is
open.
not lost?
The heavenly gates open up when someone dies from cancer. Heck, they even are open up when someone overdoses. When the brain is broken, I'm sure our Heavenly Father has those open gates just for someone else that has died because of a mental illness or a suicide. Now, that is true. I'm Catholic. It was not too long ago that, if you died by suicide, you couldn't have a Catholic funeral nor be buried in a Catholic cemetery. But gladly, I'm very proud that my faith has now opened that, because again, we need to make mental illness. Suicide happens because someone's depressed, feels isolated, feels unconnected. Just like with diabetes. If you don't eat right, you come from a family of diabetes. If you don't exercise, then the possibility you're going to get diabetes. The same thing with mental illness. If you don't meet people where they're at, then suicide is one of the inevitable outcomes. And we got to start explaining it like that, because otherwise people will continue to suffer in silence. And that number of 131 people per day is going to go to 150. I can tell you to this, and I hate to end on a sour note. In 2023, we had over 49,000 people die by suicide in America. That is even more in homicide. Even in the most crime-ridden communities such as New York, Chicago, Dallas. The numbers are escalating. They've been escalating in the last 20 years, at least 4% every year. And we need to, it is the most preventable disease that our country, that the world faces. We need to do a better job. We as humans need to do better.
I agree with you there. And not closing on a sour note, but as we get ready to close, I want to thank you because, and I hope that someone that's listening to us tonight, if you are dealing with something, and as Alice said, if you just need somebody to talk to, or you want to text 988.
Yes.
There is a live person there that you can talk to. Just like the American Cancer Society have a cancer hotline, This is suicide prevention hotline. Don't be ashamed to admit that you need help. Don't let somebody put you down and make you think that you're really off your rockers
or less up
just because you need help. And I do know, and I have reached out to Alice on occasions where I've had to call her, and she has directed me where I need to go for the person that I was with at that time that needed help. So please don't ignore mental illness. It is, as she said, a true illness, just like cancer, just like heart disease, diabetes,
COVID,
everything else. If you need help, don't be ashamed to ask for help. Don't be too proud to ask for help. And to parents, when your child come to you, don't look at it as, oh, they're just seeking attention. They are seeking attention, but give them the right attention. And as
intentional
is the word there. Intentional attention.
Be present.
Listen. A lot of times you don't need to speak. Listen. Feel their pain. And that's the way you can help them. And you don't have the answers. We don't always all have the answers. But reach out to some of the organizations, some of the numbers that she has given us tonight, and that's where your help is. Reach out. You're going to go to the doctor, like she said, if you break your leg. So if your brain is broken, find help there. And as we close out, ONV, we always say, always protect your mind.
Amen.